Dr. Dr. Ezike and I are joined today by the Acting Director of the Department of Commerce and Economic Opportunity, Michael Negron, by Karen Freeman Wilson, the President and CEO of the Chicago Urban League, and by Vanetta Roy, owner of South Shore Surf here in Chicago. I want to dedicate today's conversation to the economic pain that COVID-19 has visited upon us. Just like the virus attacks our most vulnerable people, it also hits our most vulnerable parts of our economy. It's our small businesses, our working families, our communities of color that have paid the highest price. Fighting the virus's effects on the health and safety of Illinoisans has been a top priority for me from the very beginning. And battling the economic effects of COVID has been just as important. Months ago, I recognized that we needed to prevent a housing crisis. So I banned residential evictions and placed a moratorium on utility shutoffs. Protecting jobs has been a top priority too. So I halted vehicle repossessions and launched new small business support programs. In June, we expanded assistance for those in need of food and temporary shelter, help with utility bills, and other essential services. And 2 days ago, I launched the largest rental assistance program in the nation. Today, I'm building on our work to preserve jobs and save small businesses. I'm proud to announce the first $46 million of our business interruption grant program that has been deployed now to help more than 2,600 small businesses in over 400 cities and towns across Illinois. That's 78 of our 102 counties. The initial focus of these grants has been on businesses that have been most severely impacted by COVID-19. Those that were completely shut down in the spring, and those that are in COVID-impacted areas that experienced property damage amidst the looting and civil unrest in June. Overall, the BIG program will support thousands of small businesses who have suffered losses due to the COVID pandemic, with a substantial allotment set aside specifically for child care providers, an essential underpinning of our workforce for countless working families. The federal PPP program seems to have overlooked too many entrepreneurs and small shops, and it was important to me and to the General Assembly to ensure that small businesses, which employ the largest number of people in Illinois, get the help that they need. That's why we gave priority to businesses who haven't received PPP and capped annual revenues of those businesses at $3 million or less in this initial round of funding. To ensure an equitable and efficient review and distribution in this first round of funding, the DCEO worked with community-based grant administration partners across the state. Going forward, we're taking that partnership a step further, investing $1 million in outreach and making sure that we're reaching the entrepreneurs of color through 4 community navigator partners, including the Chicago Urban League. Because a historical lack of support in communities of color is an unacceptable barrier to accessing critical resources. I am committed to supporting communities that have long suffered disinvestment. Our effort to support families and revitalize our economy are ongoing, and I intend to do everything in my power to alleviate the pain that COVID is inflicting across Illinois. Before I hand the podium over, I want to build on the updates that Dr. Ezike provided on COVID-19. Across the state, our 11 Restore Illinois regions are trending in different directions, the majority of which are negative. Comparing yesterday's data to a week ago, regions 2, 3, 4, 7, and 9 have all seen an increase in their 7-day rolling average positivity rates. Regions 1, 5, 10, and 11 have the same average as a week ago. Only regions 6 and 8 have seen a slight drop. I'll remind everyone that if a region experiences 7 out of 10 days of an increasing positivity rate, plus a sustained 7-day increase in hospital admissions, that triggers tougher mitigations for that region. 3 consecutive days of a positivity rate averaging 8% or more will also lead to automatic state action. I want to emphasize again that local officials should pay close attention to the data for their communities and, where necessary, step up and impose greater mitigations on a targeted basis to bring down the number of infections or the positivity rate. Otherwise, it will only be a matter of time before the state will be forced to step in and roll things back on a regional basis, something none of us wants. And as the General Assembly formally upheld yesterday, local governments now have an additional way to keep their residents safe. There is a new statewide IDPH rule that gives communities and businesses a greater ability to enforce masks and distancing and protects businesses that act in good faith from being penalized because of their competitors who are acting in bad faith. The virus is still among us and will be until a treatment or vaccine is developed. And in the meantime, masking and distancing are 2 of the most important things that we can do to stay healthy and safe during this pandemic.